So, hello everyone, welcome to the class. So, yesterday we talked about in previous class about brain neurology. In that, we discussed about different types of hemorrhages and different types of traumas. So, today we will discuss about brain tumors. Okay, according to neurologically, what are the important tumors and how it looks in the radiology. So, tumors are brain tumors nowadays very common. Okay, and surgeries are most common. We have two types of tumors. One is benign, non-cancerous, and one is malignant, that is cancerous. Cancerous will grow fastly and it will spread all over the brain or from the brain to the other parts. Benign will convert into malignancy also sometimes, or sometimes it will not spread. It will have some impact, occupied some tumor. Okay, it will not. It will grow slowly, gradually. Okay, and it is not affect to the other organs. Okay, so these things are basic things we have to remember. For all types of tumor, what is the investigation of choice? Investigation of choice for tumors that are contrast MRI. Okay, contrast MRI. So it will highlight the problem, how much amount of tumor is there, where it's situated. Okay, so these are the things. But sometimes we have another type of MRI also. Sometimes we need it, that is MR spectroscopy. Spectroscopy. Okay, this is another type of scan. So in that, what they will see that is one chemical, that is choline. Okay, choline if is peak, so it means that the higher chances of malignancy. Okay, and this is how they differentiate benign and malignancy. So these are the basic things. So what is the most common brain primary tumors in the adults? That is brain tumor. Okay, that is meningioma. Primary tumor benign. Cancerous is metastasis. Okay, metastasis. Okay, so most common brain tumor in adults is benign, that is meningioma. So this is the most common meningioma. So where did meningioma occurs? It occurs in the meningi. Anywhere meningi, we have the dura mater, arachnoid matter, and pia mater. These are the coverings of the brain. In that, anywhere will happen. So let's see the image of meningioma first. You can see that this is the meningioma. This is the dura, and you have the CSF here. This is the meningioma, tumor or in meningi. So it is extraaxial, not intraaxial. Intra means in between the, it is not inside the brain. It is outside the brain, within the cranial bone. Okay. So this is the very important thing we have to remember. How it looks like. You can see this is the meningioma, arachnoid layer. Okay. So this is the meningioma, the most common tumor in the brain in the adults. This is the thing we have to remember. Next, common tumor that is seen in the that is glioblastoma. Okay, you can able to see this is the glioblastoma. So mostly the glioblastoma site is frontal lobe in adults, and it also cross the midline. Okay, or there are lot of necrosis, dead tissues, like you are able to see here. Lot of dead tissues, dead tissues present in glioblast. So this is the image of glioblastoma. Next common, next type of next tumor that is seen in the uh, brain, that is oligodendroglioma. This is pituitary adenoma. Okay, okay. So we'll talk about pituitary gland. So you can see that this is a pituitary gland. In that there is a tumor. So it may be our two types. The tumor within the uh, pituitary gland are two types. One is micro, small, and second one is macro, some large. How we identify that is macro or micro? Macro is more than 1 centimeter. 1 centimeter means it is more than 1 centimeter is macro. Micro means less than 1 centimeter. So we'll call micro and macro. So you can see here, there is the tumor, optic chiasm, hypothalamus, pituitary tumor here, pituitary gland and pituitary tumor. So it is below 1 centimeter, that is micro. Above 1 centimeter is macro. What is the investigation of choice for micro or sorry, macro adenoma? That is CE MRI, contrast based MRI. For microadenoma, so you done contrast MRI, so it is more than 1 centimeter. So you have to need to check the microadenoma. So we have DCI MRI, dynamic contrast enhanced MRI. So for macro CECT, no sorry, CE MRI, not CT, MRI. For micro DCI MRI. Okay. Dynamic contrast enhance MRI. So these are the most common pituitary tumors. You can see here also a tumor in the pituitary gland. Pituitary gland here. You can see pituitary gland, hypothalamus, tumor in pituitary gland. So it is very common in females mostly. You can see this image. You can see that MRI shows the mic. It is macro, mostly larger. It is smaller. So this is mostly DCI MRI. This is how they look. This is CECT MRI. Here CE MRI. Okay. You can see macroadenoma, microadenoma. Okay. Next, common type of, not common, is seen in the, that is in the adults, that is CP angle tumor. also known as schwannoma. It is seen in cerebropontine tumor, angle tumor between is cerebro and pontine. Between that, it will arise from that area. So there is a reason we will call CP angle tumor. Okay, so you can see that this is the CP angle tumor here. Okay, so it is mostly seen in adults between 30 to 40 years age. Okay, so it is more risky. It is challenging if it happens. Surgery sometimes possible, sometimes not possible. Surgeon will decide, but it is like death. It is like a death. Okay, CP angle tumor is like a death. Okay, next we have children's. What are the most common types of tumors in the children? In the children, we have two common types of tumors are most common. That is benign, one is malignant. Benign is first is PA tumor. Okay, PA tumor or PA tumor, that is pylo pylocystic pylocystic astrocytoma. Astrocytoma. This is most common. It is cerebellum. It is present in cerebellum. Okay, so this is the benign, not cancerous. Cancerous, we will see after that. You can see this pylocystic astrocytoma. Cystic astrocytoma, cerebellum. You can see that edema, cyst, and here nodule also present. This is present in the cerebellum. So patient have difficulty in walking or balancing. Okay, sometimes breathing issues. Okay, so this is most common in uh, age group of 5 to 10 or 5 to 15 years. Okay, so this is benign cancer. But what is cancerous tumor? Most common malignant or cancerous tumor, that is medulloblastoma. Medulloblastoma. So you can see here in this image, this is the cerebellum. In that the tumor, you can see medulloblastoma. Okay, how it looks like in the scanning, you can see this is the brain tumor medulloblastoma. You can see here. Okay, so this is the cancerous. It is also seen in mostly 0 to 10 years children. Okay, so it is very dangerous tumor like CP angle tumor in the adults. In the children, medulloblastoma is very dangerous. So it can take the life of the person of the children. Okay, it is also known as grade 4 tumor. So after affecting, only they will be able to see that tumor. Okay, so these are the different types of tumors. Okay, are there. These are the most common tumors what we studied. Other also there, but rare. You can see that, but these are the common seen in clinical cases, surgical cases. Most of the doctors, neurosurgeons will operate or will treat it according to the condition. Okay, so we discussed brain trauma and head trauma, tumors, and hemorrhages. Okay, in coming class, we'll discuss about Next, what we will discuss about radiology. In the radiology, we have neuroradiology. In that, we will discuss about CNS infections. Okay, and mostly CNS infections we will discuss. Okay, so in that we have metabolic diseases also, vascular problems, congenital problems, demyelinating of neurons. We will discuss in tomorrow's class. Okay. So this is all about in today's class. Any doubts, kindly ask.